Hey everybody, this is Dr. Jones, CEO of Colorado Medical Solutions. And if you're watching today's webinar, then you are here to learn about erectile dysfunction. And you probably know about erectile dysfunction because you're probably dealing with it, but more importantly, what we can do to help you get rid of that erectile dysfunction. So, and we have a lot of different options to help people who are struggling with erectile dysfunction. So, again, my name is Dr. Jones, and I'm a chiropractor, and I am the clinical director here at Colorado Medical Solutions. We are located in Denver and Colorado Springs, and our mission statement has always been to reduce prescriptions, prevent surgeries, and restoring optimal health. And we do that through an array of holistic medical services. And so let's just go ahead and get into it because we got some good information to cover. So what is erectile dysfunction? Well, it doesn't just mean I can't get it up, although that's the crux of it, right? Erectile dysfunction is defined as the inability to maintain or obtain an erection suitable to have sex, to have intercourse. So either you can't get it up at all, or you can't get it firm enough, or you can't keep it firm long enough to have intercourse. All of these are different blends, different versions of erectile dysfunction. And how do you treat erectile dysfunction? We're going to talk about that today and what the current medical system offers as far as treatment options. And then we're going to talk about why choose us, because we do feel very confident in our ability to treat erectile dysfunction. So what is erectile dysfunction? Okay, so erectile dysfunction, like we said earlier, is that inability to maintain and obtain an erection suitable for sex. Well, what is it in terms of how do we get it and what's actually causing it? So there are essentially one main thing that affects the penis, and that's blood flow. So when we have an issue with blood flow, that is going to be the primary reason, and there's multiple reasons why you might have an issue with blood flow, but blood flow is the main category of issues that affect penile function. Now, you could have some physical trauma, you could have some neurological issues, those might go hand in hand, they might not, or you can have some psychological issues too as well. But we have found that these are pretty rare, and it's actually interesting to note that most of the psychological issues from ED stem from just the simple fact that they have a difficult time getting an erection, and that stresses them the heck out. So literally just focusing on the physical problem, giving that man his confidence in his ability to perform in the bed when the time calls is going to usually, in most cases, rid him of any bit of psychological component to the erectile dysfunction. So we can bring it back to the physical part, which is a blood flow issue. Now, blood flow is as simple as the amount of blood vessels in the penis, right? Well, over time, as we age, due to many reasons, inflammation being the biggest one, like we've talked about in our other webinars, we lose blood flow to the penis because we don't have the continual growth of new blood vessels as we did when we were younger. And then also we get a development of plaque in the blood vessels too as well. So these are the two components that are going to affect penile function. So the impact of erectile dysfunction, I think, is huge, right? It's very stressful for a man to not be able to perform. It's embarrassing. Hopefully you have a supportive spouse, a supportive significant other, but at the end of the day, whether they're supportive or not, it's going to affect your mental well-being. It's going to affect your confidence, most likely, and that's going to impact your health, because one component of ideal health is good mental stability, and it's hard to have mental stability when you're anxious about the fact that you can't perform, or you don't know if you're going to be able to perform this time compared to last time because your ED is very inconsistent. Or even worse, you have full-blown erectile dysfunction and you just can't have sex at all. So for a man, this can be pretty debilitating. And it's interesting that some people refer to this as the most important organ in a man's body, which is kind of funny, but at the same time, though, there's something to that, because while we know it's not the most important, a man can function without his penis and live a healthy life, relatively speaking, but his mental well-being is most likely going to crash if he can't perform and he can't have sex. So we got to get this problem fixed, man. If you have it, stop downplaying it and look for a solution. Find something so that you can regain your mental health because of it. So let's talk about the current medical community and what they're offering in way of treatments. So I think the big one we've all heard of is Viagra and Cialis. And so Viagra and Cialis both work by improving the release of nitric oxide. Nitric oxide is a chemical in the body that causes a whole array of different effects, but the end result of this release of nitric oxide is increasing in the size of the blood vessels, which therefore increases blood flow to the area. So it's very powerful. Anybody who's tried Viagra most likely gets a pretty powerful erection, although in many cases that are more severe, not even Viagra works. And we have many men that come into our clinic that struggle with even obtaining an erection from Viagra. So the problem with all medications is the side effects, which is why our mission statement has always been to get you off prescriptions. But Cialis and Viagra are pretty nasty. Some of the side effects can even be, believe it or not, blurred vision and hearing loss, temporary hearing loss, right? And it's crazy because some of the men I talk to just go, oh yeah, it only lasts for a couple minutes or maybe an hour. And I'm like, that's okay with you to go temporarily deaf or a little blind? What's happening in the body that's leading to those situations where you have blurred vision or an issue with hearing? And it's because of the intracranial pressure, the pressure within the head from the increase in blood pressure from these medications. So our goal is to get you off medications, and we're going to talk about how we can actually do that. So I'm not a big fan of that. And in more severe cases, they use surgical methods. There are methods where they can actually insert like a balloon, and you can inflate the balloon when you want to have intercourse. I think that is the worst thing you can possibly do, especially with the treatments that we're going to talk about that are out there. I would say for me, that is last ditch. Nothing else works. Maybe you've had severe neurological trauma or physical trauma and nothing's going to work, then by all means. But most men do not want to have a balloon inserted into their penis, and I don't blame them. So what are the methods of treatment that we have available for men? So the first thing that we're going to talk about is the P-shot. And the P-shot is a revolutionary procedure. It was invented and discovered or sort of created by Dr. Charles Runnels. And what we're doing with this procedure is we're extracting the platelets from your body. We draw your blood, we spin it in a centrifuge, we pull out the growth factors, and we can inject those growth factors into the penis. Now, platelet-rich plasma, or PRP, is used all over the medical community right now, primarily in the musculoskeletal realm, but it's also used in cosmetics and hair, and now it's being used in sexual wellness, sexual health. And remember, we talked about the mechanisms of erectile dysfunction, and we said blood flow, right? Well, what do you think is going to happen to the amount of blood vessels that you have when we add growth factors? They're going to grow. You're going to get angiogenesis, and you're going to get development of new blood vessels and regeneration of some of the dying blood vessels, which ends up leading to improved erectile function, or improved penile function. Additionally, some of the awesome perks is our men get bigger. That's not the reason that I recommend you get it, although you certainly can. And we're not talking increased length here. That can happen. What's reported more commonly from our patients is increasing girth. And I can attest to that because I've done the procedure myself. And I wanted to make sure that it didn't hurt, because I know the idea of a needle in the penis can freak some men out. So I just had to confirm, and it doesn't hurt. We do a good job numbing the penis before we poke it. And then at the very, very end of the procedure, where they end up injecting into the tip, you feel a tiny little poke. It's not bad at all. So just get rid of that anxiety, because you probably have more anxiety from the fact that you have ED to begin with. So the P shot is a very powerful procedure. Now, it is the second weapon in our tool shed. Our first go-to weapon is Shockwave therapy. Now, you may have heard of the Gainswave. This is exactly the same thing as the Gainswave. This is extracorporeal shockwave therapy, if you want the medical terms. But basically what this technology is modified sound waves. I know that sounds a little interesting, but there's a lot of research behind this. And so what those sound waves do, it's a machine where the technician is going to rub it onto the area and rub it for a period of 15 to 30 minutes. And for the treatment of erectile dysfunction, she's going to cover all the different areas of the penis, the base, the perineum, and all those areas where there's lots of vasculature and blood flow. You're going to get that done successively. The best fashion is twice a week. And this is an interesting technology. And the reason why I like it as my number one is because you get both angiogenesis, increase in blood vessels, but two, you also get a breakdown in the plaque in the vessels. You don't get as much as that from the P shot, but you can get both. You'll get better blood vessel growth from the P shot, but you do get some blood vessel growth from the wave therapy. So this is usually our go-to session of 6 for our minor to moderate cases of erectile dysfunction. More will be needed if it's more severe erectile dysfunction. Now, if you're dealing with Peyronie's, a horrible condition where the penis bends to the side and there's literally no help from the medical community. They just tell you that's it, you gotta live with it. But what I have found is that it's plaque. It's plaque in the penis that's causing the penis to bend. And it can happen pretty abruptly. Over the course of a couple weeks, all of a sudden your penis starts bending. That mechanism of the rapid onset, we don't really know yet, but I have seen personally patients through lots of wave therapy sessions rid themselves of Peyronie's. So we can actually help with Peyronie's too as well. And we definitely want to get a P shot in there too as well. So these are the things that we're going to discuss with you when you come into our practice, when you have a consultation with our staff, so that we can really figure out what makes the most amount of sense. Minor cases, maybe you just need wave therapy. More advanced cases of ED, you're going to probably need both. These are some of the benefits of wave therapy: decreased recovery time between orgasms, better erection quality, stronger erections, increased stamina, increased sensitivity, confidence, girth as well. Girth is a big thing because, especially if you're getting both therapies, it's almost guaranteed that that's going to happen. Lots of benefits for this. So why us? Why choose Colorado Mego Solutions? Well, I think that we have a really good system grooved down for treating erectile dysfunction. I love the fact that we utilize our mission statement in everything that we do, which is reducing prescriptions, preventing surgeries, and restoring optimal health. So even with our ED treatments, we're trying to be as natural as possible in order to relieve you of such a devastating condition. Now, I want to add something here. There's a scale that I like to use when I rate erectile dysfunction. So on a scale of 0 through 10, 0 would be 0 penile function, no matter what. 9 would be the perfect erection, the perfect firmness. It works exactly the way you need it to, the way it used to work when you were younger. 10 would be a little too much, like you took a little too much Viagra, and then everything in between, right? So these treatment options are there for you, whether you're a 0, and I've had patients that haven't had an erection for 14 years. In fact, I got one particular patient in mind who's more than likely going to share his story. As you can imagine, it's tough to share a story like that, but he's already said yes. So look forward to that video. But he didn't have an erection for 14 years and came into our clinic, and it took time. It took time, but he is now having sex with his wife. And just imagine the change in his life. But whether you have something that extreme, or maybe you're a 6 or a 7, you can have sex, but it's just not the way you remember. It's not the way that you used to. Maybe you want to go into the sack a second time. Maybe you don't want to have to wait a day or two to have sex again and feel embarrassed about it. You'd like to be able to have sex and look at your wife and let's do it again, like the way you used to when you guys were younger. That kind of goal is very common. Like I don't have erectile dysfunction. I just want to improve my stamina and my endurance and my erections. And wherever you stand in that spectrum, we're definitely here to help you at Colorado Medical Solutions achieve a better erection with the most safest natural procedures that are out there on the market. So please, if you're watching this, don't hesitate to give us a call.